Hi everyone, it's Dr. Dave, and during this episode, I am going to address a few common myths surrounding heart disease. These are actual questions and comments I have received over the last week. In fact, I will go as far as calling this segment Dr. Dave's 411 Heart Disease Myth Buster. In this episode, we will answer, at what age does heart disease start? Do heart palpitations mean you have a heart problem? And is the rising incidence of erectile dysfunction a part of normal aging?
In impotence and in potence.
Rising incidence of erectile dysfunction part. Never mind. All this and more on Dr. Dave's 411. Myth number 1. Dr. Dave, I am 40 years old. Am I too young to worry about heart disease since it only occurs later in life? Sincerely, Bob from Ohio. Bob, this is probably the biggest myth I hear on a daily basis. Atherosclerosis, the buildup of cholesterol in our heart, starts really early. In fact, during the Korean War, autopsies on American soldiers, average age of 20s, revealed that 77% of soldiers had some evidence of atherosclerosis. In the Vietnam War, it was approximately 45%. So if you have cardiovascular risk factors, you should speak to your doctor about getting screened. Now, you don't need to panic and run to your cardiologist, but usually men 40 and women 50 should think about getting screened. I would strongly recommend speaking to your cardiologist about a test I have spoken about many times called the coronary calcium score. Please check out my prior video on this topic. And remember, if you have any cardiovascular risk factors such as high cholesterol, hypertension, family history, make sure you address them. Myth number 2. Dr. Dave, I have extra heartbeats or palpitations, so I must be having a heart problem. Help me, Angela, New York. Extra heartbeats or palpitations are very common and often not serious. The heart is an amazing organ that beats approximately 100,000 times a day in a mostly regular pattern, kind of like a clock. But occasionally, we may feel extra heartbeats. These extra heartbeats can be brought on by stress, dehydration, caffeine, and many other causes. Pay attention to your extra heartbeats. Are they regular? How fast is your heart beating in a minute? Is there a pause after each extra heartbeat? Providing this information to your doctor is important. Even though the majority of cases are benign, meaning they're not dangerous, I always recommend seeing your cardiologist to get checked. Myth number 3. Dr. Dave, I heard if a person has erectile dysfunction, it is just a part of normal aging. Thanks, Steve from Miami, Florida. Steve, this is not entirely true. Yes, erectile dysfunction affects approximately 40% of men in their 40s and 70% of men in their 70s, but is much more than aging. If you have erectile dysfunction, you're at higher risk of having a heart attack. There is a very strong link between erectile dysfunction and heart disease. Having erectile dysfunction can increase your chance of having heart disease up to 50 times higher than a person without erectile dysfunction. Why? Because atherosclerosis, the buildup of cholesterol and plaque, accounts for 50% of erectile dysfunction in men over 60 years old. That same plaque buildup is often occurring throughout the body, including the heart. I would go as far as saying, if you need a little blue pill, then you need a heart check. Okay, everyone, that is it. The 411 on some myths surrounding the heart. If you have any additional questions or comments, please put them in the comments section. I may not always be able to respond to your personal question, but I will add it to my future Mythbuster episodes. And finally, if you like this episode, like, follow, and share it with your loved ones. It may save their life. Until next time, this is Dr. Dave.